The following video is an example of a patient, Mrs. Jones, who's experiencing a cataract. Enjoy. Hi, Mrs. Jones. My name is Grace. I'm going to be your nurse today. Tell me what brings you in.
It's my eyes. I can't see like I used to. My vision is very blurry and foggy.
Okay.
Yes.
Do you wear glasses or contacts?
I wear glasses.
You do? Okay. Do you ever have eye pain or do you see double?
I don't have eye pain, but I do see double from my left eye.
Okay. What about your night vision?
My night vision, it's a little bad at night, especially when driving.
So driving is bad, okay.
Yeah.
What about when you look at a light? Do you ever see like a little halo around your light?
I do see halos.
Yeah? Okay. Okay, Mrs. Jones, can you tell me what medications you're taking?
Well, I'm 85 years old, so I take a lot of pills. I take a liver pill, I take a heart pill, I take a bowel pill, I take prednisone for my arthritis.
Okay. Do you have any other underlying health conditions?
I have diabetes.
Okay, so you take insulin?
I do, but I forget sometimes to check my sugar levels. I forget to take it often.
Okay. And do you smoke?
Yes, I've been smoking a very long time.
How many packs a day do you smoke, and could you estimate how many years you've smoked for?
So I'm 85, so I've been smoking probably like 70 years.
Okay.
And probably about 2 packs a day.
Okay. Okay, is there anything else about your vision that's bothering you that you could tell me about?
Yes. I have a milky white patch.
In your left eye?
Yes, and I'm very self-conscious about it.
Okay. Well, next I'm going to do an examination. So I'm going to take a look at your eyes and see what's going on. The symptoms that you told me, blurry vision, double vision, your decreased night vision, and your increased prescriptions for your eyes. You told me that your doctor keeps...
Oh yeah, see how thick these are?
Yeah. So those all aren't very normal for eyes, and so we're going to do an examination on you. Okay, Mrs. Jones, I'm going to do an eye test. So I'm going to have you keep your glasses on, and I want you to read the smallest line of letters on this chart while covering one of your eyes with that piece of paper.
Okay. EFPTOZ.
Okay, good. Now, that's the smallest you can read, right?
Yes.
Okay, now switch eyes and go ahead and read what you can.
Oh dear. I can only see the big letter, the E. It's double. It's very blurry.
This is not normal. Any patients with findings over 20/30 vision should be recommended to see an eye doctor. Cataracts can lead to nearsightedness or myopia, such as Mrs. Jones is experiencing. This means that people with this have trouble seeing things far away. Okay, Mrs. Jones, I'm going to go ahead and take a look at your eyes. If you could just look straight ahead for me. I'm just going to look at your pupils. Make sure they're the same. Okay, and then can you follow my finger in and back out? Okay. Next, I'm going to test your cardinal field. So if you could just follow my finger, okay? Good. Okay, I'm going to go ahead and have you cover your right eye with that piece of paper. And I want you to tell me when you can see my finger, okay?
No. 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 No.
Okay, can you go ahead and cover that around? Okay, Mrs. Jones, I'm going to test your peripheral vision one eye at a time. So I'm going to do your right eye first, okay? So tell me when you can see my fingers moving.
No.
No. Okay, and we're going to do your left eye.
No.
Okay, one more time.
No.
Okay, great. Thank you. Due to the cataract in Mrs. Jones's left eye, her peripheral vision was impaired compared with her right eye. Okay, Mrs. Jones, I'm going to check your cornea. So if you could just look straight ahead, and I'm going to shine a light. Okay, great. Thank you. And next I'm going to look in your eyes, okay? So just look straight ahead for me, okay? When looking into Mrs. Jones's eyes with the ophthalmoscope, there were opaque black areas against the red reflex in her left eye. These black spots are abnormal and are indicative of cataract. Okay, Mrs. Jones, after talking with you about your symptoms and your blurry vision and your foggy vision and the worsening of your peripheral vision, and after completing your physical assessment, it appears that you have a cataract in your left eye.
A cataract? What's that?
A cataract is just a painless clouding of the crystalline lens in your eye. It's from a clumping of proteins. This is the milky white film that you noticed and you explained to me earlier. The good news is that it's curable with lens replacement surgery.
Oh, thank goodness, this is curable. Why did this happen?
So age is the primary risk factor for developing cataracts. Actually, about over half of adults over the age of 80 have them. So it's not uncommon, and also women are more likely to get them as well. You also mentioned that you were taking prednisone for your arthritis. So corticosteroids such as that can often affect your eyes and cause cataracts. So we can take a look at your medications and see if maybe you can switch over to something else. Also, you did mention that you had diabetes, and this can lead to eye conditions also such as cataracts. So this could also lead to the development of it.
Are there any other reasons why this may have happened?
Well, cigarette smoking also can be associated. You said that you've been smoking since you were 15, so that's 70 years, and this could have been the cause.
My husband always tells me to stop smoking, but I'm never one to let a man tell me what to do.
Well, Mrs. Jones, if you would like, I can give you resources before you leave to help you quit smoking. There are many options that you can use to help you quit or even cut down on the number of cigarettes you smoke a day.
I suppose I could look at them.
Excellent. Also, before you leave, I will give you the name of a doctor that you can consult for your lens replacement surgery to remove your cataract if you wish.
Oh, that would be great. The girls at the Bridge Club wouldn't be able to recognize me.
If you or your husband, Bertie, have any questions, please do not hesitate to give me a call.
Thank you.